Welcome back to the Morning Blend. It's a widespread problem across the U.S. and right here in Nevada. Kidney disease affects approximately 10% of Americans. To help local residents, two groups have teamed up together to create a new special needs program. Here with more about this is Ada Ndulaka, a nurse practitioner at Healthcare Partners, along with Dixon Keller of Humana. Good morning to both of you and welcome.
Good morning.
Ada, let's start with you. Kidney disease is a big problem that affects a significant number of people here. Can you tell us a little more details?
Kidney disease is widespread across America. In America, about 10% of the people have kidney disease, and about 3,000 residents in Nevada are actually on dialysis. Kidney disease occurs when the kidneys are unable to filter out waste products out of the blood properly.
Now, if it's left untreated, what happens?
If left untreated, patients usually go on dialysis. They can either go on dialysis or get a transplant. Dialysis is a highly involved process. When the patient's on dialysis, they have to be on a dialysis machine at least 3 times a week, 3 to 5 hours per treatment session.
For the rest of their lives, or?
For the rest of their lives, or unless they get a transplant.
A transplant. All right. So it's something that definitely needs to be taken care of. You cannot ignore it.
Definitely. And we recommend that the 2 leading causes of kidney disease are actually diabetes and hypertension. So we recommend that patients that have these conditions get screened at least once a year to check how well their kidneys are functioning.
Now, Dixon, there's a new special needs plan available, especially for designed for patients with end-stage renal disease. What exactly is this?
Well, under traditional Medicare, patients have gotten dialysis, but there really hasn't been a true integrated system of delivery for the Medicare recipient until now. Recently, Humana has teamed up with DaVita Healthcare Partners to create a brand new special needs plan for the Medicare recipient with end-stage renal disease, and it's called Humana Kidney Care. And Humana Kidney Care is made to increase benefits and lower costs for Medicare beneficiaries.
So that's a good thing for patients.
That is a great thing, especially when compared to traditional Medicare. Now, the medical network will be made up of doctors and specialists from Healthcare Partners, whereas the plan recipients will receive their health care, their professional services, their hospital services, and their prescription drug services from Humana.
And that way they're taken care of, they know what they need, they're under a plan as well.
Absolutely. Plus integrative system. Everybody talks one to another, so it's a great way for healthcare treatment. Everybody's on the same team.
Exactly. And patients under this plan obviously will receive coordinated care from Healthcare Partners, and it's something called the Total Care Model. Can you explain to us what that means?
Yeah, the Total Care Model at Healthcare Partners is patient-centered, meaning that we focus on the patient and their overall health. With this model, we're able to work with primary care providers, specialists, and other health professionals who carefully work to manage the patient's care and overall health. With this type of coordination, we have better outcomes and lower health care costs.
And obviously beneficial to the patient. And they don't have to worry about it. They'll let the doctors take care of everything and coordinate their care.
Exactly.
So that's the purpose of this, because they're going through so much already.
Exactly.
And this Total Care Model is something that you will sign them up for, or should they ask for it?
Well, I think they can go to Humana.com and check out the insurance plan.
And Dixon, can you tell us a little bit more about Humana?
Absolutely. To learn more about Humana Kidney Care, patients can just log on to www.humana-medicare.com, or they can call local number 702-837-4401. We're right here in Las Vegas.
And again, you cannot ignore this problem because help is available.
It is.
Yeah.
It is.
Absolutely.
And again, the treatment to be pre-screened for diabetes and hypertension.
Yes, patients with those conditions, we strongly urge for them to get screened at least once a year to see how well their kidneys are functioning.
If your parents have diabetes or your parents have hypertension, or it runs in your family, are you at higher risk for it?
Definitely, definitely. So it's good to at least get an annual physical once a year to make sure that your numbers are not borderline or actually you are diabetic or hypertensive.
And Healthcare Partners has how many people in its network of doctors and professionals?
We have about over 3,000 professionals working with us, working in the system.
And everything from a specialist to a general practitioner?
Yes, and we work with dietitians, we work with case managers, so it's really a whole care It's not just one aspect of the patient's care.
And Dixon, if someone wants to enroll in Humana, how do they do that?
Well, they can either call one of us at our office at the number that is listed on the screen. They can go onto our website. We also have 2 Humana Guidance Centers in the city. One is on Green Valley Parkway in Pebble. The other is on the corner of Fort Apache and Charleston. And we always have staff there that can answer questions. Plus, there's a lot of educational events and things going on. So please visit a Humana Guidance Center.
Dixon, can you give us that phone number one more time?
Yes, 702-837-4401. All
right, thank you so much. Some great information for us this morning.
Thank you.
Thank you.
Take care of your kidney health and get your special needs met. For more information about the new partnership between Healthcare Partners Nevada and Humana, just visit the website right there on your screen. Still to come in the Morning Blend, Rock the Troops.